Hello everyone, I'm Dr. Aditya Sai from the Shoulder and Knee Clinic. Welcome to our channel. So here we talk about various issues pertaining to shoulder and knee injuries, shoulder and knee surgery, and thanks for liking, sharing and subscribing to us. So we have gained a lot of followers recently and we would like to thank them. So today we are going to discuss about shoulder replacement, what you can do, what you can't do after the shoulder replacement surgery. Now we need to understand, obviously a lot of things depend on your surgeon's protocol and how they feel that it should be proceeded ahead, but we are obviously going to discuss what we follow here. So we'll divide it into various phases and obviously based on the nature of shoulder replacement done. So typically there are two varieties of shoulder replacement surgeries. One is anatomical shoulder arthroplasty, where the natural anatomy of the shoulder is preserved, and the other one is a reverse shoulder arthroplasty. So post an anatomical shoulder arthroplasty, typically your hand will be in a sling for 6 weeks. From third week onwards, certain exercises are started which will help preserve the mobility in your shoulders. Essentially, passive movement of the shoulder till 90 degrees and a bit of external rotation stretches. Post 6 weeks, you start seeing the physio more frequently, and at that time they progress to the complete movement of the shoulder, and we start working on improving your shoulder strength starting at around 2 to 2.5 months post surgery. And typically by 4 to 5 months you should have regained the full strength and movement in your shoulder. Post an anatomical shoulder arthroplasty, especially in the first 3 months, you're not supposed to take your hand behind your back like this, and you're not supposed to take your hand to get off the chair. So that's very important to understand, because this is the position for dislocation of shoulder for an anatomical shoulder arthroplasty. In the long term, it's always advisable that you avoid lifting any weight more than 5 kilos with your operated hand. Yes, you can do, but it's an artificial joint and we want it to last as long as possible. Some people are even able to go and do a bench press with that, but that's not the purpose of an anatomical shoulder arthroplasty. It's essentially pain relief and giving you mobility in the shoulder along with some strength. So keep that in mind. When we talk about a reverse shoulder arthroplasty, it's a different thing altogether. The rehab is quite faster. So from 3 weeks, you can remove the sling and start moving your hand as you tolerate it. The number of physiotherapy sessions are also lesser with a reverse shoulder arthroplasty. Generally from around 2 months, we start with a bit of strengthening. What you need to avoid is sudden jerky movements of the hand. Some people have a habit of jerking their hand up and down and doing those things and doing all sorts of rotation of the hand. So that's something you need to avoid with a reverse shoulder arthroplasty, because any significant hyperstimulation of the deltoid can get transmitted to the acromion. So that's where the whole power for a reverse shoulder comes from, and it can lead to an acromial fracture. So that's what you want to avoid. Second thing is, in the first 6 months, you should avoid getting up from a chair like this. So essentially, this is a position of dislocation for a reverse shoulder arthroplasty, and this is something that needs to be avoided in the first 6 months. In the long term, you should avoid lifting anything more than 2 kilos with the hand, again to avoid overstimulating the deltoid and causing excessive stresses on the acromion. So the aim of a reverse shoulder arthroplasty is to give you pain relief, a decent amount of function and a decent amount of movement. With a reverse shoulder arthroplasty, it is never promised to get a full movement in the shoulder. It's essentially for pain relief and age appropriate movement. So thanks for watching our channel. If you liked our video, do share, like and subscribe to our channel. Thank you.